Hey there everyone, in the previous video we had already studied the popliteal fossa, boundaries, its contents, the deep fascia, the superficial fascia and everything. So I'm going to show you the quick review. So see, this is the popliteal fossa, the definition, its location, its boundaries, and then the roof and the floor of that, and this is about the boundaries, and this is about the oblique popliteal ligament, and then its contents, and then the diagram again and its arrangement we had already seen. So now we're going to start. So today we're going to start with the popliteal artery. So first we'll see what is the beginning of the popliteal artery. Okay, so the beginning of the popliteal artery, it is a continuation. We already, all of us know that very well from my videos. If you don't watch my videos, then probably you won't be knowing about it. I'm just joking. So it is a continuation of the femoral artery. Okay, the popliteal artery it is a continuation of femoral artery at the level of the adductor hiatus or the adductor magnus, with medial 1/3 and the lower 1/3 of the thigh. So if you don't remember this, then also it's fine, but just remember that it is a continuation of the femoral artery at the level after or at the level of the adductor magnus or the adductor hiatus. So we'll see the course. It runs downwards and slightly lateral to reach the popliteus muscle. Okay, so this the popliteal artery, it goes downwards and slightly lateral to reach the popliteus muscle, and it terminates by in the lower border of the popliteus muscle by giving two branches of the anterior and posterior tibial arteries. So let us understand the beginning, course and termination by a diagram. Okay, so see, this is the popliteal artery. Whatever you see here is the popliteal artery, and this is the adductor hiatus or the adductor magnus. It continues as the popliteal artery. This is the popliteal artery on the posterior side. Okay, I forgot to make it dotted. So it is on the posterior side. It goes laterally. See, it is going laterally and into the popliteus muscle. Okay, near the popliteus muscle, and after the popliteal muscle, its termination is that it is giving off two branches. One is the anterior tibial branch and another one is the posterior tibial branch. So these are the branches of the popliteal artery, which is a continuation of the femoral artery after the adductor magnus or the adductor hiatus. So this is about the beginning, course and termination. Now let us see what are the relations of this artery. Okay, the popliteal artery. So we have relations on the anterior side, on the posterior side, on the medial side and on the lateral side. So let us see on the anterior side. The anterior side is deep. Remember this, the anterior side is deep and the posterior side is the superficial. Okay, why? Because anterior side we have muscles, we have the capsule of the knee joint, okay, we have fascia, but on the posterior side we can feel the depression, right? We can feel the popliteal fossa, so it is superficial, and on the anterior side it is deep. Okay, so what are the contents? Okay, so what are the relations on the anterior side? So see, this you remember in this order. So this is the first one, this is the second one, this is the third one. So it has three. Okay, 1, 2 and 3 relations. Okay, so whatever you see here, this is the popliteal surface of the femur. We had already seen, right? So suppose these are the condyles of the femur, and this is the region where the popliteal surface of the femur, it is the popliteal surface of the femur. So first is the popliteal surface of the femur, and then we have the back of the knee joint. So see, this is the knee joint, and then the lower side, okay, and the anterior side itself. On the lower side we have the fascia of the popliteal muscle. So of the popliteal muscle, whatever is there, it's always present with its fascia. So we have the fascia of the popliteal muscle. We have also seen in the previous video that the fascia of the popliteal muscle and the popliteus muscle as well, it is forming the it is present in the popliteal fossa. So it is always present with its fascia. The roof is formed by the popliteal muscle and its fascia. Okay, the roof of the popliteal fossa. So we are done with the anterior or the deep. Now we're going to see the posterior and the superficial. So see, on the posterior side, we know that there is tibial nerve, right? The tibial nerve goes posteriorly. So see, if this is the red one is the popliteal artery, so this is going posterior posterior to it, okay, posterior to it, and the yellow one whatever you see here is the tibial nerve. So posteriorly we have only one, that is the tibial nerve. Anteriorly we have the bone, the joint, and the fascia and the muscle. And on the medial side, whatever you see on the medial side of this artery, so suppose this is the lateral side and this is the medial side, okay. So see, this is the artery, the red one is the artery. So on the medial side, first we have this medial condyle of the femur, and after that we have the semimembranosus muscle on the medial side, okay. And to the medial side we have the tibial nerve, and after that we have the popliteal vein, and along with that we have the gastrocnemius, okay, the medial head. This is the medial head of the gastrocnemius because we are seeing it on the medial side, right? So this is the medial side of the gastrocnemius. So it's upper and lower. Upper we have the medial condyle of the femur and the semimembranosus, and in the lower part we have the popliteal vein, the tibial nerve, and the medial head of the gastrocnemius. So this is about the medial relation. Now we are going to see the lateral relation. So of course we had the medial condyle, so on the lateral side we have the lateral condyle of the femur, and the muscle we have the biceps femoris muscle. We have already seen the boundaries, right? So it is kind of similar to that. And we had the medial head of the gastrocnemius in the medial side, and on the lateral side we have the lateral head of the gastrocnemius. So this is the popliteal artery as you see, and we have the plantaris muscle. The plantaris muscle is a degenerated muscle, and it is homologous to the palmaris longus muscle, as we have already studied this in our previous video. So see, medial side semimembranosus, medial condyle of the femur, popliteal vein, tibial nerve, and the gastrocnemius medial head. And on the lateral side, the lateral condyle of the femur, the biceps femoris muscle, the lateral head of the gastrocnemius, and the plantaris muscle. So if you remember the diagrams easily, it will be very very simple to understand and write the same diagram in an elaborated format, so it is going to surely get your marks. So we are going to see the branches of the popliteal artery. So what are the branches of the popliteal artery? So see, this is the popliteal artery. It is beginning, or it is a continuation of which artery? The femoral artery at the adductor, at the adductor hiatus or the adductor magnus, okay. So this is the popliteal artery. So it gives off 6 branches, 1 2 3 4 5 6 7 actually, okay, 7 branches. So first one is the cutaneous branches. It gives us cutaneous branches, it gives us muscular branches, okay. So then it gives superior medial genicular branch, superior lateral genicular branch, inferior medial genicular branch, and inferior lateral genicular branch, and the genicular artery in the middle, okay. So this is the medial genicular artery, okay. So this is the medial genicular artery. It pierces the oblique ligament. We have seen this genicular artery, genicular vein, and the genicular nerve, medial genicular nerve. They are they are passing or piercing the oblique ligament in the popliteal fossa. That is the oblique ligament that is present obliquely inside the popliteal fossa. So we have already studied that, so this is very much important to know. So see, the popliteal artery, it gives off cutaneous branches and the muscular branches that do the blood supply to it. And then we have the superior lateral, the superior medial, the inferior lateral, okay, the inferior lateral and the inferior medial, and in the middle we have the medial artery, okay, the medial genicular artery, which pierces the oblique ligament and supplies the muscles over there. So we are done with the beginning, course, relations, branches, termination, all about the artery. Now we are going to see what about the popliteal vein, okay, about the popliteal vein. So the beginning of the popliteal vein, see, we always remember that the artery, it starts from upside and the vein is totally opposite to it. So it is beginning from the lower side, not from the upper side. So we are going to see the popliteal artery, popliteal vein. So it is beginning from the, so its beginning is from the lower border of the popliteus muscle, okay. See, lower border of the popliteus muscle. We're going in the opposite direction again because we're studying the vein. So lower border of the popliteus along with the anterior and the posterior tibial arteries, okay. Okay, we'll see this in the diagram, and course also we'll see in the diagram. The termination, it continues as the femoral vein in the opening of the adductor hiatus or the adductor magnus. So see, I would like to show you something. So see, suppose this is the adductor hiatus or the adductor magnus, and this is the femoral artery. It is coming like this, and it is forming the femoral the popliteal artery. So the popliteal vein, it is going in the opposite direction through the adductor hiatus, and then it is forming the femoral vein. So the femoral femoral artery forming the popliteal artery, and the popliteal vein going upward to form the femoral vein. Okay, so you remember this. Okay, so this how you have to remember. Now let us see the diagram. See, so this is the femoral vein. We'll see from the downside, of course. So see, okay, it is divided into three: the upper part, the middle part, and the lower part. We'll see from the lower. So the red one is the popliteal artery, and whatever blue you see is the popliteal vein. So it is medial to the popliteal artery. Okay, the popliteal vein is in the lower part, it is medial to the popliteal artery. As it goes in the middle, it is on the posterior side, and as it goes upper, it is on the posterior lateral side. It continues as the femoral vein in the after the adductor hiatus. Okay, so this is about it. We have already seen it, right? We have already seen this relation. We had seen AV and then NVA, again NVA, like this. Okay, AVN on the upper side, medial side vertically AVN, and lower side horizontally AVN. So right, so if you remember this mnemonic, it will be very much easy to understand. So we saw the beginning, course, termination, and how it is related in the lower, middle, and the upper. Now we're going to see the branches of this. So see, this is the popliteal vein, gives off a small branch, that is the small venous vein. Okay, that is the small venous vein, and gives off a branch that is corresponding with the popliteal artery branches. Okay, the muscular branches that are corresponding to the popliteal artery, and then it gives vein committance. Okay, I don't know actually how to pronounce this, but it's vein committance. So what does it mean is that the veins, it is in close contact, or it is closely related with the same corresponding arteries, or called as a vein commitment. Okay, so see, this is the posterior tibial artery vein. So this is the posterior tibial artery. So this is the anterior tibial vein, and this is the anterior tibial artery. So it is called as a vein commitment. So it's it ends up doing this. So this is about the popliteal vein. We have done with the popliteal artery, popliteal vein, its beginning, course, termination, diagram, branches, relations, everything. So in the next video, we are going to do the tibial nerve, and then we are going to do the peroneal nerve, and end up doing the genicular branch of the obturator nerve, and then we are done with the whole chapter. Only genicular anastomosis, or the anastomosis of the knee joint, will be left. So we will cover that in a separate video, which will be very easy to understand. To make sure to watch the previous video and the previous playlists, and also the physiology videos. Thank you so much.